says thousands of women have the same type of breast implant that's been linked to a rare type of cancer. So should they risk going under the knife again? A local surgeon offers her advice. If you or someone you know has gotten breast implants, you're going to want to stick around for this next story. After the break, we welcome to the set a local plastic surgeon who has an important message about a scary new discovery. Stay with us. And welcome back. The pharmaceutical company Allergan is recalling a particular type of breast implant after it was linked to a rare form of cancer. It's called BIA-ALCL, or breast implant Associated-Anaplastic large cell lymphoma. The FDA says there are nearly 600 cases of this cancer worldwide, resulting in 33 deaths, and most of them involve textured implants provided by Allergan. So I am happy now to be joined with a local plastic surgeon, Dr. Elisabeth Potter. Thank you so much for being here to help us understand this.
Thanks for having me.
You've been outspoken about this textured implant recall that we have been reporting on the last couple days. For starters, what's the texture that we're talking about with these specific this specific type of implant?
It's a great question. So every breast implant has a covering. In the case of a textured implant, that covering feels like suede. It adheres to the body's tissue, similar to velcro when it's placed into a breast and is held tightly in place.
Why would someone choose that specific type of implant over another if it has that velcro-like feel to it?
Such an interesting question. Initially, these implants were created in response to a women's desire to have a more natural-looking breast augmentation. So shaped implants or anatomic implants were designed, and it was necessary to hold them in place from spinning or from rotating. So that texture was initially designed as a benefit to create a more natural-looking breast. Unfortunately, we now know that that texture has created a problem.
And if you are one of the thousands of women who have this type of implant, what should you do? I know when we first heard this, we thought, recall, that usually means, you know, if it's another type of a product, you send it back or something. What should women do if they have this implant?
I think it's really important for women to know that they're their own best advocate. So I think that getting the information about the risk of breast implant-associated lymphoma is the #1 goal. I think that you should talk to your board-certified plastic surgeon about the risks. You should talk about the signs and symptoms to look for and carefully weigh what that means for you. For some women, that might mean having the implant removed. For some women, that might mean carefully monitoring it. That's a personal decision.
What is it about the implant that is linking it to this specific type of cancer? Do doctors know what the link is?
You know, I think that our understanding of this disease is evolving. Clearly, there's an association between the texture and a woman's immune system. And for some women, that association leads to an overactivity of the immune system in the form of cancer. It doesn't happen for every woman. We're still looking into exactly what that interaction is resulting from. I think that it's clear now, though, that the texture plays an important role, and that's why the FDA has decided to remove this textured implant from the market.
All right, really interesting context. Thank you so much for coming here and helping us to understand this really important issue.
Thanks for having me.
Dr. Elisabeth Potter, thank you so much for being here today.
Yep.